100 questions plus answers for doctor's competency test. Topic: Pediatrics. 1. A 2-year-old child presents with fever, cough, and intercostal retractions. Chest X-ray shows hyperinflation. What is the most likely diagnosis? Answer: bronchiolitis. 2. A child with a barking cough, stridor, and hoarseness. What is the most likely diagnosis? Answer: Croup, laryngotracheobronchitis. 3. What is the first-line treatment for Kawasaki disease? Answer: intravenous immunoglobulin, IVIG, and high-dose aspirin. 4. A neonate with jaundice appearing within the first 24 hours. What is the most likely cause? Answer: hemolytic disease of the newborn. 5. A child with diarrhea, dehydration, and metabolic acidosis. What is the likely cause? Answer: acute gastroenteritis. 6. A 5-year-old with fever, malaise, a vesicular rash on the trunk, and a history of exposure to a sick sibling. What is the diagnosis? Answer: varicella, chickenpox. 7. A neonate fails to pass meconium within 48 hours. What is the most likely diagnosis? Answer: Hirschsprung disease. 8. A child with fever, non-blanching petechia, and low platelet count. What is the diagnosis? Answer: immune thrombocytopenic purpura, ITP. 9. What is the most common cause of meningitis in children under 5 years of age? Answer: Streptococcus pneumoniae. 10. A child with a heart murmur, wide pulse pressure, and bounding peripheral pulses. What is the diagnosis? Answer: patent ductus arteriosus, PDA. 11. A neonate with a cleft palate and recurrent infections. What syndrome is suspected? Answer: DeGeorge syndrome. 12. A child with a painless abdominal mass and hematuria. What is the likely diagnosis? Answer: Wilms tumor. 13. A 3-year-old presents with a sandpaper, rash, fever, and a strawberry tongue. What is the diagnosis? Answer: scarlet fever. 14. A child with polyuria, polydipsia, and weight loss. What is the diagnosis? Answer: type 1 diabetes mellitus. 15. What is the first-line antibiotic for suspected bacterial meningitis in a neonate? Answer: ampicillin and gentamicin. 16. A child with macrocytic anemia, glossitis, and hypersegmented neutrophils. What is the diagnosis? Answer: vitamin B12 deficiency. 17. A 5-year-old with recurrent wheezing, eczema, and a family history of asthma. What is the most likely diagnosis? Answer: asthma. 18. A neonate with microcephaly, hearing loss, and petechia at birth. What is the most likely infection? Answer: Congenital cytomegalovirus, CMV. 19. A child with a painful limp, hip pain, and limited internal rotation of the hip. What is the diagnosis? Answer: transient synovitis. 20. What is the most common congenital heart defect? Answer: ventricular septal defect, VSD. 21. A child with short stature, webbed neck, and wide-spaced nipples. What syndrome is suspected? Answer: Turner syndrome. 22. A neonate with severe jaundice and bilirubin of 25 mg per deciliter. What is the treatment? Answer: exchange transfusion. 23. A child with failure to thrive, diarrhea, and a positive sweat chloride test. What is the diagnosis? Answer: cystic fibrosis. 24. A 6-year-old with fever, sore throat, and swollen anterior cervical lymph nodes. What is the likely diagnosis? Answer: streptococcal pharyngitis. 25. A child with pallor, irritability, and a hemoglobin level of 7 grams per deciliter. What is the most common cause? Answer: iron deficiency anemia. 26. What is the most common cause of pneumonia in children under 5 years? Answer: respiratory syncytial virus, RSV. 27. A child with edema, proteinuria, and hypoalbuminemia. What is the diagnosis? Answer: nephrotic syndrome. 28. A neonate with projectile vomiting and a palpable abdominal mass. What is the diagnosis? Answer: pyloric stenosis. 29. A child with a barking cough, inspiratory stridor, and fever. What is the treatment? Answer: dexamethasone and nebulized epinephrine. 30. A 2-year-old with an asymptomatic heart murmur that disappears when sitting upright. What is the likely diagnosis? Answer: innocent murmur. 31. A child with petechia, hepatosplenomegaly, and blasts on a peripheral blood smear. What is the diagnosis? Answer: acute lymphoblastic leukemia, all. 32. A 1-month-old with apnea, bradycardia, and desaturation. What is the diagnosis? Answer: neonatal sepsis. 33. A neonate born with a herniation of abdominal contents through the umbilicus. What is the diagnosis? Answer: omphalocele. 34. What is the first-line treatment for otitis media in children? Answer: amoxicillin. 35. A child with prolonged fever, conjunctivitis, cracked lips, and rash. What is the diagnosis? Answer: Kawasaki disease. 36. A neonate with cyanosis that improves with crying. What is the diagnosis? Answer: choanal 37. A child with a painless limp, hip stiffness, and avascular necrosis of the femoral head. What is the diagnosis? Answer: Legg-Calvé-Perthes disease. 38. A 3-year-old with nocturnal wheezing and coughing. What is the diagnosis? Answer: asthma. 39. A child with nasal polyps and recurrent sinusitis. What is the diagnosis? Answer: cystic fibrosis. 40. A 4-year-old with a barking cough, difficulty breathing, and inspiratory stridor. What is the immediate treatment? Answer: nebulized epinephrine. 41. A neonate with persistent hypoglycemia, macroglossia, and a large body size. What is the diagnosis? Answer: Beckwith-Wiedemann syndrome. 42. A child presents with pallor, splenomegaly, and a hemoglobin electrophoresis showing HBS. What is the diagnosis? Answer: sickle cell anemia. 43. A child with fever, rash, joint pain, and elevated ESR. What is the diagnosis? Answer: juvenile idiopathic arthritis, jaw. 44. A 6-year-old with ear pain, a bulging tympanic membrane, and fever. What is the treatment? Answer: amoxicillin. 45. A neonate with abdominal distension, bilious vomiting, and no air in the rectum on X-ray. What is the diagnosis? Answer: intestinal obstruction. 46. A child with hematuria, hypertension, and edema after a sore throat. What is the diagnosis? Answer: post-streptococcal glomerulonephritis. 47. A child with recurrent fever, oral ulcers, and pharyngitis. What is the diagnosis? Answer: cyclic neutropenia. 48. A child with a high fever, lymphadenopathy, and a maculopapular rash. What is the diagnosis? Answer: measles. 49. A neonate with conjugated hyperbilirubinemia and acolic stools. What is the diagnosis? Answer: biliary atresia. 50. What is the initial treatment for neonatal sepsis? Answer: broad-spectrum antibiotics, e.g., ampicillin and gentamicin. 51. A newborn presents with cyanosis worsening during crying. What is the most likely diagnosis? Answer: choanal 52. A 3-year-old child presents with high fever, barking cough, and inspiratory stridor. What is the diagnosis? Answer: Croup, laryngotracheobronchitis. 53. What is the hallmark physical finding in a child with tetralogy of Fallot? Answer: systolic murmur at the left lower peristernal area. 54. What is the most common pathogen causing bacterial meningitis in newborns? Answer: Group B Streptococcus, Streptococcus agalactiae. 55. A child with short stature. Distinctive facial features, short neck, hypertelorism, and congenital heart disease. What is the diagnosis? Answer: Noonan syndrome. 56. A baby presents with projectile Non-bilious vomiting and weight loss. What is the diagnosis? Answer: pyloric stenosis. 57. What is the first-line treatment for a simple febrile seizure in children? Answer: antipyretics such as paracetamol. 58. A child presents with maculopapular rash, fever, and white spots on the buccal mucosa. What is the diagnosis? Answer: measles. 59. What is the main complication of severe bronchiolitis in infants? Answer: respiratory failure. 60. A newborn has pale skin, low heart rate, and slow breathing. The Apgar score is 3. What is the first step? Answer: neonatal resuscitation with positive pressure ventilation, PPV. 61. What are the clinical signs of intussusception in children? Answer: sudden abdominal pain, vomiting, and red currant jelly, stools. 62. What is the main cause of iron deficiency anemia in children? Answer: inadequate iron intake. 63. A child presents with progressive muscle weakness, pseudohypertrophy of calf muscles, and a positive Gowers sign. What is the diagnosis? Answer: Duchenne muscular dystrophy. 64. Which vaccine prevents pertussis? Answer: DTP, diphtheria, tetanus. Pertussis. 65. What is the primary treatment for Kawasaki disease? Answer: intravenous immunoglobulin, IVIG, and high-dose aspirin. 66. A newborn has jaundice within the first 24 hours of life. What is the likely diagnosis? Answer: ABO or RH incompatibility. 67. What are the diagnostic criteria for type 1 diabetes mellitus in children? Answer: hyperglycemia. Fasting blood glucose is greater than or equal to 126 mg per deciliter, or random blood glucose is greater than or equal to 200 mg per deciliter, with classic symptoms. 68. What is the most common cause of acute diarrhea in children? Answer: rotavirus. 69. A child with a history of upper respiratory infection now presents with periorbital edema and hematuria. What is the diagnosis? Answer: post-streptococcal acute glomerulonephritis. 70. What is the main treatment for typhoid fever in children? Answer: antibiotics such as azithromycin or ceftriaxone. 71. A newborn with an umbilical cord that has not detached after 4 weeks. What is the likely condition? Answer: chronic granulomatous disease. 72. What are the characteristic clinical signs of rickets due to vitamin D deficiency? Answer: bowed legs, widened epiphyses, and coastal rosary. 73. A child with bone pain, lytic lesions on X-ray, and elevated calcium levels. What is the diagnosis? Answer: Langerhans cell histiocytosis. 74. What is a major risk factor for sudden infant death syndrome, SIDS? Answer. Prone sleeping position and exposure to cigarette smoke. 75. A child with recurrent episodes of wheezing triggered by exercise or infection. What is the diagnosis? Answer. Asthma. 76. What is the first step in managing severe dehydration due to diarrhea in children? Answer. Intravenous rehydration with lactated Ringer's solution. 77. A newborn fails to pass meconium within the first 48 hours of life. What is the diagnosis? Answer. Hirschsprung disease. 78. A child with excessive sweating while feeding and failure to thrive. What is the diagnosis? Answer. Congenital heart disease with congestive heart failure. 79. What is the primary treatment for vaso-occlusive crisis in sickle cell anemia? Answer. Hydration, analgesia, and oxygen. 80. A baby with persistent diaper rash that does not improve with barrier creams. What is the most likely cause? Answer. Candida infection. 81. What is the screening test for congenital hypothyroidism? Answer. Neonatal TSH and T4 levels. 82. A child presents with petechia, hematomas, and thrombocytopenia. What is the most likely diagnosis? Answer. Idiopathic thrombocytopenic purpura, ITP. 83. What is the hallmark sign of encephalitis in children? Answer. Fever, seizures, and altered mental status. 84. A child has paroxysmal coughing followed by an inspiratory whoop. What is the diagnosis? Answer. Pertussis. 85. What is the main treatment for status epilepticus in children? Answer. Benzodiazepines, e.g., diazepam or lorazepam. 86. What is the main complication of untreated pneumonia in children? Answer. Empyema or lung abscess. 87. A child presents with sudden high fever, strawberry tongue, and skin rash. What is the diagnosis? Answer. Scarlet fever. 88. What is the most common cause of failure to thrive in children? Answer. Malnutrition or chronic conditions such as celiac disease. 89. What is a hallmark finding of bronchiectasis in a child with cystic fibrosis? Answer. Chronic cough with purulent sputum. 90. What is the main treatment for severe malaria in children? Answer. Intravenous artesunate. 91. A child with behavioral issues and characteristic facial features, such as a thin philtrum. What is the diagnosis? Answer. Fetal alcohol syndrome. 92. A baby with chronic diarrhea, dermatitis, and recurrent infections. What is the diagnosis? Answer. Severe combined immunodeficiency, SCID. 93. What is the main cause of edema and nephrotic syndrome in children? Answer: hypoalbuminemia. 94. What is the first-line treatment for secondary hypertension due to kidney disease in children? Answer: ACE inhibitors. 95. A child presents with fever for 5 days, lymphadenopathy, and bilateral conjunctivitis. What is the diagnosis? Answer: Kawasaki disease. 96. What are the clinical criteria for hyperbilirubinemia requiring phototherapy? Answer: total bilirubin greater than 15 mg per deciliter in a term neonate. 97. A child with easy bruising and prolonged prothrombin time. What is the diagnosis? Answer: hemophilia. 98. What is the most common cause of upper airway obstruction in a newborn? Answer: laryngomalacia. 99. What is the main complication of measles? Answer: encephalitis. 100. What is the main treatment for cholera-induced diarrhea in children? Answer: oral rehydration with ORS solution.